Hello, welcome to the CIRS Healing Collective expert guest video series. I'm Jenny Johnson, the host and facilitator of the CIRS Healing Collective, which has been a resource for aspiring CIRS overcomers to share and connect from around the world since 2020. I'm a shoemaker proficiency partner and CIRS coach, and most importantly, an overcomer myself. What you're about to see is a 10-minute excerpt from a 90-minute group discussion that members of the CIRS Healing Collective got to have live with this expert guest. If you would like to see the full 90-minute replay, come on over to the CIRS Healing Collective. We have a robust video library from the past 5 or 6 years of so many expert guests. Better yet, you'll be able to join our future monthly live discussions with experts to come. We'd love to have you. Okay, so I'm so excited to have Andrea Jordheim with us. And Dr. Jordheim is an upper cervical chiropractor. She's trained and certified in functional medicine. She's also trained and certified in the shoemaker protocol. So she's got a lot of cool things going here. She's also trained, certified in the Bredesen protocol for brain health and in various nutritional kind of approaches. She's really very broad in what she has experience and training in. And she's no stranger to mold illness. So she's actually a member of our CIRS Healing Collective. She lays low because she's a clinician and she's busy, but she understands our community, and she is here to share with us. She has a clinic in Grand Junction, Colorado called Transformation Wellness Center, or Transformation Wellness Center. And a few of you are actually patients of hers, I believe. So yeah. So without much further ado, Dr. Jordheim, I'm so excited for you to be with us. And I did submit all of your questions that you submitted to me. I organized them and passed them along to Dr. Jordheim so that we can be as efficient and effective as possible in getting to as many of them as we can. There may end up having to be a part 2 because there were a lot of questions. But we'll go ahead and see what we can get through without feeling rushed and with some time for questions. Cool?
Perfect.
Everybody good? Okay, so Dr. Jordheim, first question on the list is, how is chiropractic care most valuable for CIRS patients? And kind of a sub-question, is it common for CIRS patients to not hold adjustments well? And maybe why?
All right.
Yeah.
Okay, perfect. All right. This question's a bit of a loaded one, I would say. One of the reasons that I kind of started to venture more into the world of CIRS came from the amazing changes I saw with patients from a more kind of global and specific upper cervical standpoint from a chiropractic approach. But there were those patients who just still weren't getting well. I noticed over time that the patients who tended to, quote, not hold adjustments, my experience so far, if they've really taken the time and kind of done all of the things that most people do when they, see a chiropractor, or they start doing functional medicine care, and they might be doing more natural approaches and dietary things, but they're still not, getting the results they want or holding the adjustments, was usually because those patients ended up having CIRS. Now, that doesn't mean chiropractic care isn't great for it. I think the value of chiropractic, and, I can speak a little more towards my specialty, and we're dealing more with brainstem function and the autonomic nervous system and the ability for the body to coordinate, sending information to the rest of the joints and the organs and everything and back to the brain. And so if there's dysfunction in the upper cervical area near the brainstem, that is going to have a global impact on everything. And oftentimes we see that with chiropractic, maybe all of the adjustments patients are needing, or the issues in their upper back or low back, and they always need it to be adjusted, are because those are really compensations for something more important. The body will always sacrifice structure to preserve function. My experience in the beginning for those who maybe come in to see me for upper cervical care, and they have no idea about CIRS or whatever, they just know that they need some kind of help in that area, they will improve. They'll definitely feel better because we're balancing that autonomic nervous system. The thing is, though, with a lot of CIRS patients, doing that and keeping that balance is important. There's strategies and things you can do at home too without having to come in constantly and get adjusted. But after a period of time, if you don't actually treat CIRS, and by treating CIRS, I'm really saying 95% of CIRS treatment is getting out of exposure and remaining out. That's the thing that trips people up the most. That's the hardest part of it, but by far it is the most important thing.
Makes so much sense. And that's what we keep hearing over and over, that removal from exposure is really the big bang for the buck. Like that's the big thing, and not to keep treading water with other things unless you have to. There are some of us who are stuck in a situation that's less than ideal. We've got an exit strategy for 6 months from now, but this is our reality. Or we're trying, we're looking for that, new house, but in the meantime, what can we do to at least try to feel better? So these are some strategies for that population to try to feel better, or maybe impact their autonomic nervous system so that they can digest their food better, maybe detox a little better, maybe sleep better, so that at least they're making some, or at least they're not getting worse while they're waiting.
Absolutely. And that is my experience, is when I do work with patients and they do receive, and again, my expertise is upper cervical chiropractic, so that they do get those very specific types of adjustments that help to balance the sympathetic nervous system, working on vagal nerve tone stuff. We know that the vestibular system, so that balance system of the body, is very much impacted by upper cervical function and how those top bones are moving. They're freely movable bones, so they should be moving. It's just, are they moving correctly? And if they're not, that's when we see the more global, what we call central nervous system pathophysiology. So I think this might be lower down, like, can upper cervical issues be the root cause of dysautonomia, or can issues with that area have more of a big global effect? And the answer is yes, because it's coordinating everything. And so if we're trying to, get our head to be attached to our body in a sense that this is a whole unit and not just one thing over the other, which often becomes dysfunctional. If you don't have those top bones moving correctly, the body is going to have to adapt and compromise. It's going to have to do something, because that area is the most important vital area in the body. And there's so much neurological input there.
Yep. Makes sense. Start with getting out of exposure if possible. And then the upstream really treatment for the body, for the neuromusculoskeletal system, is this upper cervical area, because that's where, if we're having joint, nerve, autonomic nervous system dysfunction, vagus nerve issues, those can all be impacted by this upper cervical region. So starting there rather than starting maybe downstream is maybe a great place to start if you're still having body pain, joint pain, dysautonomia. Am I understanding that right?
Yeah, no, I mean, we all want to think that we have the answers to everything. Just do this and just come and see me, you guys. You'll be just fine. Unfortunately, that's not the truth. I always screen patients before upper cervical care. Not everybody needs it. If you do, though, it really is a good place to start, because think about like a foundation of a house. If you have a poor foundation on your house, you might have cracks in the walls and the windows won't open or shut and the doors are crooked. It doesn't make sense to go in and try to fix all of those things. Fix the foundation first, and then sometimes that other stuff self-corrects. And that's what we see with upper cervical is I have patients who still see their other chiropractors, or they still get other stuff done. I see them for upper cervical, and now instead of having to go get that other stuff done so frequently, they just hold all of their adjustments better. So it's starting at a root cause thing, just like CIRS can be a root cause of a lot of functional medicine or other systemic health issues, SIBO and all that kind of stuff. It makes more sense to get at a root cause treat that, see what's left over, and then go in and address those areas. And you're going to get a much better response, because if you try to adjust a low back or a knee or whatever, and you have upper cervical dysfunction, I can guarantee you will not hold that adjustment. You just won't. So making sure that that's not part of what's going on is important. It depends on the upper cervical doctor. When I see patients, I use a technology that it kind of allows me real time to see that central nervous system dysfunction. It's called computerized infrared thermography. This is a really neat tool that they also use for breast cancers and stuff, but the application that we use here in office is, instead of having to shove a needle into your spinal cord and see what kind of neurological function we have, that kind of highway, do we have any traffic jams or not? We can do a scan right at the back of the neck that lets us look at that brainstem central nervous system. And we're looking for balance, to have symmetry and balance. If we do, you don't need upper cervical care. And that can be a thing too. People go, oh, my body hurts, I think I should go get this therapy. What if you don't really need it though? And that's the thing too with some of these questions is, you have joint pain and stuff, but how do I explain to my family what it feels like to have so much joint pain? But I don't have rheumatoid arthritis. They've ruled out all of these things. It's quote unquote in my head. And the thing is, it isn't. You just haven't had, true dysfunction of the joint. It's more of a kind of functional inflammatory response that's happening and hasn't progressed more. In those instances, you wouldn't want to have therapies that manipulate the joints a lot, or get upper cervical care if you don't need it. I think, yes, it can be a really important piece for people. Often those people who I see who get referred from other chiropractors, I can almost guarantee if you got referred from another chiropractor to me, you definitely have upper cervical care, because they're noticing you're not holding their other adjustments. So yes, it is. Right. It can be a really helpful and wonderful things for patients. And it's like killing a bunch of birds with one stone is one of the ways I like to say. Instead of chasing everything around, if we can get at some of these foundational things, then the body can start healing naturally on its own.
So here's the specific question. I'm still having neck issues after 2 recent concussions. My neck catches every so often when I turn my head. It's not painful, but it's annoying and it doesn't seem normal. I've had traditional chiropractic care at different times. Something about this kind of upper cervical care, something about the pain is making her reluctant to want to go back. So is upper cervical care something that could be appropriate for post-concussion, or is that a contraindication?
No, 100%. Unless there's instability in the joints, and they would see that with imaging. I will tell you, if you go to see an upper cervical doctor and they don't want x-rays, run. You need imaging. So we need to have that imaging there. And as long as there isn't instability, and usually it's just not moving properly. It's like you learn to dance when you're born, the bones know how to move. And then something happens, a concussion or some other, whiplash or a fall, or even kind of weird chronic stresses can cause issues. And then we start getting abnormal movement. It's like you've forgotten dance steps in a dance. And all our job is to retrain the motion of those bones and rebalance those ligaments and muscles so that the body can move it on its own effectively. So absolutely. I've seen a lot of patients and sometimes I say kudos to them, who've had chiropractic care in the past and have maybe been injured. Maybe they had an adjustment and it just made everything worse, or, whatever the case may be. And yet they still end up here in the office and I'm like, you're brave. It shouldn't hurt to get the adjustment. It doesn't take trauma to fix trauma. That's for sure.